Is a cabinet tax, a medicine cabinet tax, an over-the-counter drug cabinet tax. Beginning next year, 2011, for over-the-counter drugs that do no longer qualify for your health savings account. Did you know that? I didn't until today. I want to talk about it because I read John Berlau, who's a policy director at the Competitive Enterprise Institute. John, old friend, good to see you. I read your article up on Breitbart.com, Big Government, and I said, huh? I didn't know this. Real quick, walk me through this.
Well, currently, Larry, individuals with their flexible spending accounts and health savings accounts, flexible spending accounts are good. You have to use them by the end of the year. Health savings accounts or go with high deductible policies that are continue from year to year. But with both of these, you can purchase, in addition to prescription drugs, over-the-counter drugs to treat certain illnesses, such as pain relievers, prenatal vitamins, Pedialyte for your kids. That you're not going to be able to do that, as you said, starting in 2011. So if you take the account, you're not going to be able to buy these with your pre-tax account, and you take into account what Social Security, Medicare taxes, income taxes, all those things. It's an effective 40% tax hike for a lot of families.
All right, so 40% tax hike. So now, I thought the purpose of this Obamacare was to drive costs down. From reading your story, this is going to drive prescription costs up because they won't be able to, because the over-the-counter stuff won't compete near as effectively. In other words, if I got to pay out of pocket for the over-the-counter, but I get a tax break on the prescription drugs, then I'm going to have more prescription drugs and drive the cost up. I thought that was counter to everything about Obamacare, bending the cost curve down.
Right. Well, it's all about, Larry, as you've talked about so many times, dynamic scoring, looking at the behavioral effects. And one of the effects is it's going to be actually cheaper for the individual because a third party is paying for it to get the more expensive prescription drugs. And that is going to drive up the cost for the system by maybe tens of billions of dollars, as well as the cost, since the government's going to be paying for a lot of this.
John. This is exactly the reverse, A, of what we were promised, and B, what every policy wonk said was going to happen. From the congressional budget. This is incredible. So let me get this right. Medicine cabinet stuff is mostly over-the-counter. The allergy pills, as you say, the pain reliever pills, the health pills. And you can't buy that with your flexible spending account or your health savings account. So that's all been cut back. Is that what you're saying? They were against HSAs. Why? Because that was real consumer choice and personal responsibility. And they took that out in favor of a big government plan. Is that what's really going on here, John?
That really is. I don't know what the motivation for everyone. I mean, the Congressional Budget Office said it would save $5 billion over 10 years, but that's not looking at the dynamic effect, the behavioral effect. I mean, just one, when they brought non-drowsy antihistamine, such as Claritin, over the counter, that has saved about $4 billion a year, according to the American Journal of Managed Care. So if you take that with all of the over-the-counter drugs and people switching back to prescription drugs, that could cost the system tens of billions over the years.
Incredible. John Berlau, I want to thank you for your reporting. Terrific stuff. The medicine cabinet tax hike from Obamacare. All right, buddy. Coming up next on the